name's Heather. I'm a nurse practitioner student in NU 518, and I'm going to be doing an abdominal assessment today. I wanted to get your consent for the examination and to videotape it to share with my instructor.
Of course.
Perfect, thank you so much. So if you'll lie down for me and get comfortable, you can raise your knees slightly if you'd like to promote abdominal relaxation. And I'm just going to drape you for privacy and comfort right about here. And if you can raise your shirt up to your bra line, that would be great. All right, so I'm just going to adjust a little bit. Thank you. So I'm going to start by taking a look at your abdomen and inspecting. And what I'm looking for is color, which is appropriate for your ethnicity. And I'm looking for any bulges or masses. I'm looking for symmetry, and your abdomen is symmetrical. Contour is flat. I'm just going to get down here to eye level. And if I could just have you to take a good deep breath in for me and hold it for about 2 seconds. Great. I don't see any evidence of any hernias. I'm not seeing any visible peristalsis. Okay? And that's all normal. So now I'm going to actually auscultate. So I'm going to listen to all 4 quadrants of your abdomen with the diaphragm of my stethoscope. And I'm listening for bowel sounds. Okay, I'm going to start in the right upper quadrant. And I'm hearing some gurgling and tinkling sounds, which are normal. Left upper quadrant. Left lower quadrant and right lower quadrant. So I'm hearing active bowel sounds in all 4 quadrants. If I did not hear bowel sounds, or if they were sluggish, I would listen for a full 5 minutes before making a determination on that, okay? So now I'm going to listen with the bell of my stethoscope, and I'm going to be listening over some of the aortic, iliac, renal, and femoral arteries for normal arterial and vascular sounds. And I'm going to listen with the bell of my stethoscope. Okay. So that was the aorta. Now I'm listening for the renal. And I'm not hearing any bruise or adventitious sounds. Okay, and I'm going to listen for the iliac. And again, no bruise or abnormal sound. Sounds sort of like a whooshing sound. That's what that bruise would sound like. Now I'm going to listen to the femoral. Okay, perfect. Excellent. So now I'm going to do something called percussion. So I'm going to use my fingers and tap lightly over different areas of your abdomen. And I'm just listening for changes in tone to indicate organs and borders of those organs. So I'm just going to tap lightly, okay? And you can hear that sort of hollow sound, and that's normal. We expect to find that through most of the abdomen. If your bowel was full, you might hear some dullness. But I was over the ascending colon, the transverse colon, and the descending colon, and heard tympany throughout. So now I'm going to be percussing to find liver span. So I'm going to start at the midclavicular line near the umbilicus, and I'm going to go up until I hear dullness. So I should hear tympany, and then it should progress to dullness. Okay, I'm going to mark, if that's okay. Okay, thank you. And now, if you'll just displace your right breast a little bit, I'm going to percuss from the midclavicular line at your nipple line down until I hear a change. Okay. Now I'm going to measure. And what I'm expecting to find is that normal liver span would be about 6 to 15 centimeters. It's usually more like 6 to 12, but that is the standard. And what I'm seeing is 6 centimeters, so your textbook. So no liver enlargement, and that's good. That's what we would expect to find. Thank you for doing that. So now I'm going to move over to your spleen, and I'm going to percuss for splenic dullness. That's something that we don't normally find. So normally we would hear tympany throughout every field of percussion. So that's what we're expecting to find, and I'll let you know if that's the case, okay? So I'm going to start at your lowest intercostal space, and I'm going to work my way over to the anterior axillary line. And I hear a lot of tympany. Do you hear that? Mm-hmm. And that's normal, so that's good. Excellent. So now I'm going to move on to palpation. So I'm just going to be feeling lightly over your abdomen. I'm going to be feeling for superficial masses or organ borders, and to kind of get you comfortable with me pressing on your belly, honestly. Okay? So I'm just going to feel over different areas. Let me know if there's any tenderness or pain. It's a little awkward, but it shouldn't hurt. Any pain or tenderness? Okay, good. And I'm not feeling any superficial masses. Okay, very good. So now I'm going to do a deeper palpation with 2 hands, and I'm going to be going a little bit deeper. So again, let me know if there's any pain or tenderness associated with that. You're doing good. We're almost finished. Okay, perfect. So I didn't feel any masses or bulges. So now what I'm going to do is I'm going to palpate for the edge of your liver. And this is an unusual technique. It's called the hooking technique. So what I'm going to ask you to do is I'm going to put my fingers underneath your rib cage, and I'll let you know when to take a good deep breath in and then to exhale. Okay? All right, so good deep breath in for me and hold it. And I'm feeling for the edge of your liver, and now exhale. Excellent, and I did feel that slightly. You're not really supposed to feel anything major, but I did feel the slight edge of the liver, so that's good. It doesn't appear to be enlarged, as we've already noted through measurement. Now I'm going to feel or palpate your spleen. So what I'm going to do is I'm going to put my hand underneath this side, okay, at the left axillary border, and then I'm going to have you take a good deep breath in, and I'm going to feel here, and I cannot feel your spleen, which would be normal. If I did, and you can relax, if I did feel any or hear any splenic dullness or palpate that, then it would be at the left axillary, the left anterior axillary line. But we don't, so that's good. Those are normal findings. So you can pull your shirt down, and then I'll have you sit up for a minute. And what I'm going to do now is I'm just going to put my hands at the costovertebral angle on both sides, and I'm going to lightly sort of palpate that, and you let me know if you feel any tenderness, and that would indicate some kidney inflammation. Okay, here we go. Any tenderness there? Any tenderness there? Excellent. Thank you so much for your time. Everything was great, and if you'll scan the room for me, please.